Hello, welcome to the Centers for Comprehensive Wound Care and Hyperbaric Oxygen Therapy in Milwaukee, Wisconsin at St. Luke's Medical Center. I'm Dr. Jeffrey Niesgoed. I'm the medical director for this program, and I've been in this position for the past 12 years. We've had a rich history of hyperbaric medicine here in Milwaukee, and before I take you through the new center, I thought it'd be very appropriate to show you a historical perspective of the hyperbaric program here in Milwaukee. Many of you are probably familiar with the chambers Bonnie and Clyde. Let's go look at what we used for the past 40 years to provide hyperbaric services to the patients in Milwaukee. I'll meet you over on the old hyperbaric side. All right, hello again. Are you ready to take a walk through the history books of hyperbaric medicine? Come on, follow me. St. Luke's has been operating hyperbaric medicine for many years. We've treated tens of thousands of patients. In fact, these are just a few of our limb salvage patients. So let's continue the tour. We're actually standing in the hyperbaric department right now at St. Luke's Medical Center, Milwaukee, Wisconsin. We've been operating a hyperbaric medicine program here for over 40 years. Our two multi-place chambers, affectionately referred to as Bonnie and Clyde, are chambers you see here. These chambers have treated literally tens of thousands of patients. Clyde, our critical care chamber, had a capability of 6 atmosphere. This chamber treated critical care patients largely due to carbon monoxide poisoning and necrotizing fasciitis. On the other hand, our workhorse chamber from a wound care standpoint is our chamber here, Bonnie. Bonnie had much less capability from a pressure standpoint, but we were able to treat 6 to 8 patients at any one time. Now, these chambers are obviously sitting in a mothballed state right now. We're not exactly sure what their future will be. I'm hoping that we can possibly turn this into the first hyperbaric museum. Obviously, the chamber technology has improved, and we're going to show you the new chambers that have replaced Bonnie and Clyde in just a few minutes, but I wanted to show you that the technology has also improved. The hyperbaric technicians would sit back here to control the dives, and this is the panel area where they would monitor and control the operations of the chamber. You can see the gauges and the printouts are antiquated, and when you get to see the new chamber panel, you'll see how these have been replaced by newer technology. In addition, the compressors and the air handlers have also improved over the years. So this again is the compressor room, and I just wanted to show you the old compressors again. A 40-year-old plus technology have been replaced by much more efficient compressors, and I'll show you those as well in our tour of the new hyperbaric facility. Well, I hope you enjoyed that little historical tour. Let's now introduce you to the new Center for Hyperbaric Medicine here in Milwaukee. This is the waiting room, and as you can see, soft colors, soft lines. This is plane tree technology that is supposed to be more relaxing and comforting to our patients, and they built this design feature into the entire layout of the new chamber facility. This is the waiting room. Patients will enter here and register behind the desks. The secretaries will plug the patients in, get them registered, and process the initial paperwork. We have a lot of features here that are for patient comfort. You can see big video monitors. We have a patient library and refreshment center. After the patients are checked in, they are then brought back either to the wound care side or the hyperbaric side. I just wanted to show you our wound care clinic very quickly. Patients are brought back by their nursing staff and placed in one of the wound care rooms. We have 7 treatment rooms here. And as you can see, it's an L-shaped layout. Behind that wall down there is where we just were touring and looking at Bonnie and Clyde. The treatment rooms are very adequately furnished and laid out very nicely to provide wound care services to our patients. But before we enter the new hyperbaric facility, I thought I'd introduce you to some of the personnel that have been very instrumental in bringing this new service to Milwaukee. I've been working with these two individuals, Mr. Steve Fabus and Kathy Nelson, now for 12 years. In fact, they were here before I took over as the medical director. I could not have accomplished certainly anything near what has been accomplished over the past 12 years without these two individuals, as well as the rest of our team. But Steve is our technical director here. He knows the nuts and bolts behind these chamber and has a vast amount of knowledge in actually bringing the new chamber technology to us and wiring it. He's done a lot of the training. Kathy, on the other hand, is a nurse manager and has oversight of the program from an administrative standpoint, and again has been with us for many years, seeing us through thick and thin, and just wanted to introduce you to the rest of the world here, the hyperbaric community.
Thanks.
Okay, this is the entrance to the new Hyperbaric Center. We have a little bit of the history recorded here on the walls. You can see how these chambers were delivered over the years, dating all the way back to 1969 when we became operational with Bonnie and Clyde. This little history tour includes many stalwarts in hyperbaric medicine like Dr. Eric Kinwald, the grandfather of hyperbaric medicine. And actually we have a layout here that shows the delivery of our new chamber, again hoisted in place and positioned in the basement of the hospital using crane technology. As we move on into the formal Hyperbaric Center, you can see the layout. We're operational today, so you can see the staff in action. The chamber is in the background there, and again, fitting well into the plane tree design. You can see it doesn't look much like a hyperbaric chamber from the outside. We have a nurse's station here. Nurses will monitor the patients both inside the chamber as well as in the wound care rooms and provide some of the documentation. I told you that many of the technologies have improved. This is the new panel where the patients are monitored inside the hyperbaric chamber. Now this panel has been updated. You can see the color displays, the LCDs providing graphic representation of the entire dive profile. The patients are easily monitored with in-chamber cameras. And again, the hyperbaric technicians are supervising the entire dive, watching over the patients from a safety standpoint. Many patients requiring hyperbaric therapy also require wound care services. We actually have wound care rooms on the hyperbaric side to provide for patients that are requiring wound care that are also receiving hyperbaric. Here's a shot of our wound care clinic area.
Do we have rooms marked down? Okay. Dina marked them all. Did she?
Well, here we are in the sub-basement. Now, not many people get to tour the sub-basement. This is actually directly below the chamber. We're in the bowels of the hospital. This is where the fire suppression system is, the fire deluge system, the compressors, and the air accumulator tanks. Let's go take a look at the actual operations of the multi-place chamber. Here's the compressor room with the standard state-of-the-art new compressors. So the compressors compress the air. The air that is compressed is then stored in these accumulator handling tanks. One of the safety features of the multi-place hyperbaric chamber is the overhead deluge system. This is in the case of a fire. If there were a fire in the chamber, a button would be fired and immediately the entire chamber would be filled with water. That water comes from these deluge tanks. These tanks are filled with water and they're pressurized. When the switch is thrown upstairs, the water will fire out of these tanks, go up the tubing and piping into the chamber, and I'll show you where that enters the chamber in just a little bit. The last part of the deluge system is the egress of the water. Obviously, once water's in the chamber, it needs to be drained. It's drained by these large pipes here. The water will then exit the chamber and be dumped into the sewer. We're actually standing right behind the chamber. This is a maintenance area. This is actually what the chamber looks like. The decorative facade you saw on the outside obviously is for aesthetics, to make it look pleasing. But these ribs here, these steel ribs, are what reinforces the chamber and allows us to have a rectangular chamber. These support the stresses of the pressurization. Behind the chamber you can see multiple valves and tubings and pipings. This is where the fire suppression enters the chamber, the compressed air and oxygen actually enters the chamber for patient care. These pipes here are part of the fire suppression system or the deluge system. Again, when the button is pushed in the case of a fire inside, when this is activated, water will come up from the sub-basement and fill the chamber very quickly to extinguish any possible flame. Here we have a valve that was used over on Bonnie and Clyde, plumbed it here just for nostalgia's sake. You can see what the old technology and the old valves used to look like. The newer valves you can see are up here, obviously correlating with the old valve. These are hand valves. In the event of complete catastrophic failure of the system, we can actually come back here and drive the chamber by hand, either pressurizing or exhausting the chamber by hand. An intercom system that can be used to talk to the inside attendants, again, in the case of the emergencies. Here we have our gas distribution panel. This is where the oxygen can be blended with different gases, nitrogen and air, to deliver different percentages of a mixed gas to the chamber. This is used in research protocols primarily. And finally, more piping and valves. Again, this is our hyperbaric air supply. This is where the chamber is pressurized from. The air will come up from the accumulator tanks that's filled by the compressors in the subbasement up through these valves, pressurizing the chamber. This is the staging area for our hyperbaric patients. This is a waiting room staging area, if you will. Patients are brought into this area either in their wheelchairs or placed in one of the chairs that you see here along the wall. Vital signs are obtained and the patients are cleared from a medical standpoint prior to their hyperbaric treatment. This clearance is done by the nursing, technical, and physician staff. The chamber is about 60 foot in length, and this is the side of the chamber. You can see as we walk along, there's actually a chamber on either side, as well as an inner lock between the two. This is an area here, again, we use for staging. This is commonly used for our gurney patients. Patients that come in from our heliport by helicopter are brought down to this area. The elevator is directly behind you. They're brought up this ramp and placed here, stabilized prior to entering the chamber to receive their hyperbaric critical care services. All right, now for the part that you've been waiting for, the hyperbaric tour. I'm standing here with my partner and colleague, Dr. Jack Simnock. Hello again, Jack.
Good to see you.
Jack and I have been working together for nearly 10 years, providing service to many tens of thousands of hyperbaric patients in the Midwest. Jack, folks here are interested in a tour of our new hyperbaric chamber. Can you do us the honor?
I'd be happy to.
All right.
Right this way. Here we are at our hyperbaric chamber. We're really proud of this beauty. Built by Fink, a big square lock chamber we're hoping to show off to you today. Here's their logo. The first ones we knew of to be building these big square hyperbaric chambers. You can see the floor is flush at the wall, so carts can roll in nice and easy. You come in the chamber and it's nice and spacious. We've got all the latest amenities. We've got monitors. We've got a television, fire suppression system, which is very important. Nice big portholes. We can look inside and see the progress of our patients, or if they're having a problem, we can get a look at them and not just be looking sort of at a sterile a vital sign display, for example. A sink. We've got a sink. We've got nice big spacious chairs that they're comfortable on. We also can treat patients on carts. This is a 22-person capacity chamber. Again, I think I pointed out the sink, phone. So we've got a lot of capability and amenities that are not possible with a lot of the older chambers that were built more as military-style vessels or the decompression chambers converted over to clinical use, for example. We have a med lock. This lets us bring in, when the chamber's under pressure, this lets us send items in or out of the chamber. Fire control, suppression systems, deluge, masks for the inside attendants. And these doors are quite nice. They're on nice rollers, and the plates slip up as the carts roll. Well, as the door closes, the plates come up, and then they go down. So the carts can roll over them nicely. We have to sometimes make a point of knocking them down so we don't trip on them. And then we have an entry lock, which is just another lock, another addition to the chamber, so we can enter the chamber while the chamber is under pressure. And again, this is part of the American College of Hyperbaric Medicine protocol, and one of the primary indications we use hyperbaric oxygen therapy, of course, is for treatment of refractory diabetic foot ulcers. And again, it's a little bit awkward to showcase a toilet, but it's also a nice addition to our capability to provide that capacity for our patients in the chamber if they actually should need it.
All right, Jack, let's end the tour. Come on, we got patients to see, we got work to do, enough of that.
Fun time's over.
Seriously, thank you very much for your time and opportunity to show the viewers what we have here from an operational standpoint. It's been our pleasure to give you this historical tour as well as introduction to the new technologies in hyperbaric medicine. Jack, anything you'd like to say to the audience?
No, just if any of you are ever in Milwaukee, come give us a visit.
Absolutely. And I'd like to extend a special appreciation to Dr. Carolyn Fife and Ms. Dot Weir for inviting us to participate in this electronic version of today's wound care clinic. Thank you.